This is QD Clinic, and I'm Jack Cush with Room Now. QD Clinic is sponsored by Room Now's coverage of ACR Convergence 2023, where we'll be in San Diego covering the meeting live for you. Today's case, a neighbor consult. So you're putting out the garbage, you're walking back up the driveway, and your neighbor says, "Oh, Doc, wait." And she runs over to you and says, I went to my primary care doctor because of this finger. She shows you a finger. And they did some tests and said I should see a rheumatologist. I said, hey, I live next door to a rheumatologist. And so the quick story is that she's got this swollen right fourth PIP. And you look at it and you squeeze it and swollen. And she starts to tell you the story and say, wait. We're not going to do this out here in the driveway. We can go to your house or my house. So you go to her kitchen, you sit down, she makes you a cup of coffee, and the story plays out. The neighbor, this now opportunistic patient, is 51, white, fair skin, blonde, unmarried, has 2 children, living next door. Great neighbor. You would never have known she had any medical problem because she seems like she's very busy, very active. You didn't know she had any medical issues. Well, it turns out that when she was 19, she had some problems with her hands. She doesn't remember what it was. It was hard to grip things. It was hard to go skiing. And she went to the doctor and she was having belly problems. And they told her that she had an immune problem where her immune system was attacking her joints, and that they thought it was related to her grandmother's Crohn's disease. Her grandmother had died of Crohn's disease. She never had endoscopy of any sort or a biopsy. She had multiple tests, was found to be ANA negative, and she was given a drug, sounds like she was given sulfasalazine, which she took for about a year, and then sort of just stopped taking it on her own because she wasn't sure if it was helping her. She said pains were kind of come and go at that point. Anyway, fast forward now over 20, 30 years, and for the last year, she's had this single swollen PIP joint. Wasn't brought on by anything, just sort of appeared one day, been a bother ever since. She has difficulty flexing it. It feels a little tight. It's never been red. It's always swollen. It's never changed. If she wraps it, it goes away. She unwraps it, it springs right back. This has been going on for the last year. She went to the primary care doctor who scratched their heads and ordered labs showing a normal CBC chem profile. CRP was normal, rheumatoid factor was negative, and there were no other labs. When you ask about medicines, she's not taking any medicines. She just sort of deals with the discomfort. It doesn't change her job. She kind of has a desk job. She said a long time ago she self-diagnosed herself as being gluten sensitive, and she, when she went on a gluten strict avoidance diet, she had no GI complaints. When she was eating bad, she would get bloating and occasional diarrhea and whatnot, but again, never any bloody or greasy diarrhea. Currently, she's not having any symptoms, but she says she's been fairly adherent to her low gluten, no gluten diet. Family history is notable for a grandmother who died of Crohn's disease. She herself, again, has no other diagnoses, takes no other medicines. Review system is negative for things like a rash, any eye complaints, current GI symptoms, back pain, heel pain, fever, weight loss, nausea, vomiting, diarrhea, oral ulcers, etc. So the question is, what are you going to do? And how much are you going to charge her for this visit? She makes a wonderful cheesecake, and that's kind of where I went on this. I told her that she should probably follow through with actually seeing a rheumatologist and getting more formal testing and regular follow-up, and she agreed to do that. But I told her that As far as diagnosis, she doesn't have one right now, but I think that time will take care of it. So teaching point number one, not all diagnoses need to be made at the first visit. Time, as you know in rheumatology, is your best diagnostic tool. You have all the labs that you need currently to not make a diagnosis. If you feel overly compelled to make a diagnosis, go ahead, spend a few $1,000s in labs that are not likely to make you any smarter, and you're more likely to find random stuff. Your future lab testing should be based on the findings that you have in play. So secondly, what does she have? She's got a chronic monoarthritis, which the differential diagnosis is almost the same as a chronic oligo, except for if it's a chronic monoarthritis, you really have to consider cancer and chronic infections like TB, fungus, weirdo bugs, things like that. But again, she's had this for over a year. She tried to tell me that it was like 12 years, and then I got it down to about 12 to 15 months. But this is going on so long that it's unlikely that this is going to be a malignancy and or a chronic infection. She hasn't traveled. She doesn't eat bizarre foods. She, not been exposed to anybody with TB. So the other differential diagnosis at this point, which I told her in the next 10 years, something will crop up, uveitis and a cult colitis that becomes clinically apparent, etc. So she could have, the spondyloarthritis spectrum of disorders, from enteropathic arthritis to psoriatic arthritis. I doubt spondylitis, but even Whipple's and strange things like that. This could be just plain simple seronegative RA, and not until she has multiple joints will I even consider that. I always think in chronic mono or oligoarthritis, crystals, and in the hands it would have to therefore be CPPD. Pigmented villonodular synovitis, foreign body would be the rest of my differential diagnosis on this kind of case. Anyway, I told her, you're happy not taking medicine? Fine. Wrap it up so the swelling goes down. Take Tylenol if you need to. But yeah, follow through with a rheumatologist for chronic follow-up, because time will give her a firmer diagnosis. Again, Room Now will be covering ACR. I told you in yesterday's QD clinic the tip for ACR 23, and that was to go ahead and make sure you attend our daily recap panels at 9 p.m. Eastern, 6 p.m. Pacific time. You can find it on our channel, on YouTube, on LinkedIn, on Facebook, and also on Twitter. We'll be broadcasting those at 9 p.m. Eastern sharp. Today's tip number 2 is everyone has their topic. Sal is a vasculitis guy, and Sarah, she just loves lupus. But if you have a topic that you really want to follow from the ACR, one, go to my website, go to your registration page, and you can sign up and check a box where you'll get a weekly topic email. Anything that we publish that week on your topic will be sent to you every Monday or Tuesday. So what kind of topics can you sign up for? Gout, spondylitis, autoinflammatory, drug safety, fibromyalgia, lupus, psoriatic arthritis, rheumatoid arthritis, TNF inhibitors, IL-17, IL-23, IL-6. There's a novel therapies and anti-rheumatic therapy. A lot of emails you can sign up for, and that will come to you the days following the ACR. You'll get like 40 of the citations that were all about autoinflammatory disease. Also, you can follow your topic on certain topic pages on our website during the meeting next week. We have topic pages for RA, PSA, SPA, lupus, and the JAK and TIC inhibitors. Lastly, you'll see late in the week recorded topic panels and recorded topic podcasts where the faculty and experts in this field will get together and talk about the highlights on your topic. This is what you do to get the most out of ACR with the least amount of effort on your part. Hope you enjoyed it. We'll talk tomorrow about another tip for ACR and another new case.